A new survey finds many women of childbearing age with chronic inflammatory or autoimmune disease feel they don't have adequate information to make informed decisions when it comes to treatment and planning for a family. Here to provide important information for these women are Dr. Grace Wright, rheumatologist at New York University Langone Medical Center, along with Rosanna, a mom of 2 kids who has lived with rheumatoid arthritis for 30 years.
Thank you so much for allowing me to share my story with you today. I've had rheumatoid arthritis for my whole life, and I've dealt with chronic pain and discomfort, as well as the emotional burden of not being sure if I was able to have a family of my own, which is something that was very important to me. When I was in college, I decided to take matters into my own hands, and I decided that I needed to find a physician that was a good fit for me. So I found Dr. Grace Wright, and she has helped me to live the life that I want to lead, which includes less pain, and she also helped me along with my family planning journey. And today, as a result of that, my RA is very well managed. I have a wonderful husband and 2 amazing children. I am a pediatric occupational therapist, and I deal with everyday struggles just as every other mother does, but it's very important to me that I have a physician that I trust, which is Dr. Grace Wright.
Rosanna, what could have helped you during that time?
Absolutely. It would have been really important for me to have resources available so that I would have known what types of questions to ask Dr. Wright during my family planning process.
What would you say to other women with autoimmune disease who may be going through the same struggles you did?
I think that every woman with an autoimmune disease has the right to feel hopeful that she will be able to have a healthy pregnancy and, as a result, have healthy children. And she needs to find a physician who's able to help her with dealing with her disease as well as maintaining a healthy pregnancy. And it's also important to find support in other women who are dealing with the same issues that we are dealing with, so that we don't feel as alone and isolated, which is why I think the AIM movement is so very important.
Dr. Wright, what did the survey identify as some of the biggest concerns among women of childbearing age who live with chronic conditions?
Sure. So this is a survey that was really directed towards women living with diseases such as rheumatoid arthritis, Crohn's disease. These are sort of chronic inflammatory diseases that women have to struggle with, as Rosanna said, every day. And the concerns were really across the spectrum. But what was eye-opening about the survey was that almost half of these women made the decision to delay their pregnancy or to not become pregnant at all because of the fears and concerns that they had around pregnancy and managing their disease. And the second eye-opener was really that there were 1/3 of women who chose to discontinue their care just before becoming pregnant, or actually as soon as they became pregnant, if in fact that might not have been the best treatment strategy for them. And then we have, again, 41%, only 41% of women actually consulted a healthcare provider as they were making these decisions. So clearly there are lots of disconnects between women and their healthcare providers concerning this particular issue, and there are lots of fears and concerns that arise, as they can with any woman, but really amplified here when you're struggling with a chronic disease.
What can be done to help these women get more information as they start to think about family planning?
Sure. So the AIM movement, I'm here with UCB, really supporting health awareness around this issue. And the AIM movement really is directed at creating a resource where women can go to find the answers to these questions, find out about the questions that they should be asking, share their stories, so that we really create a community of support for women. And this is at the AImotherhood.com website, which really is a great resource for the community.
Thank you, ladies, for being with us. Living Well will be right back.